All right, good afternoon. I'm Charity Menifee, the Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. In our local incident command structure for the COVID-19 pandemic, I'm serving as the Direction and Control Officer for this response. Due to the scope of the situation and our unprecedented coordination for this response, Dr. Buchanan and I will be alternating appearances in these briefings for the foreseeable future. We're starting these briefings every day with a note of gratitude. First, we want to highlight the teamwork that is happening between our hospitals and healthcare partners. They continue to come together to make decisions and respond to this event above all else with a sense of community. They are managing changes in guidance and directives and the situation as a team, and we couldn't be more proud to call them our partners in these efforts. Next, we want to thank the other businesses and their workers, from child care centers to grocery stores and convenience centers and truck drivers to so many more who are keeping us going. And finally, we want to thank again the individuals, the families, the businesses that have disrupted their lives and their livelihoods to do their part in responding to this pandemic by staying at home. We are truly grateful for everything that each of you are doing. Now we're going to shift gears a little bit to our current case counts. As of 11 a.m., we have 20 cases here in Knox County, and I'm happy to report that 6 of these individuals have recovered. Our focus continues to be on identification, isolation, and contact tracing. And what I want to do right now is explain what that means, because I think that people need more information. There's a lot of unknowns, and that scares people. So we want to explain what our response looks like. And I'm going to back up and explain that this is something that we do all the time. We have over 70 reportable diseases in Tennessee that our team investigates daily. And this is just a new one for us, and we've had to expand our efforts, obviously, to support it, but it's something that we do all the time. So first, identification. So when positive cases for any of these diseases, including COVID-19, come in, they get reported to us. That can be from the Tennessee Department of Health via a lab report that came in. That can be a doctor's office that calls us and reports a positive case of a disease, in this case, COVID-19. We immediately, and our first priority always is to contact that individual person that has tested positive for the disease. We will do that with this. We are continuing to do that for this. People are scared when they find out that they have this, and we want to be able to talk to them, explain what the risk is, how they can help protect their other family members that are in the home, how we can follow up with their close contacts. We talk to them first. We do a very in-depth interview with each of these individuals. From there, we've also talked to them in that interview and gathered their contacts. And so that's where that investigation and contact tracing piece comes in. We want to talk to people that they've been in close contact with, and so then we can inform them of their risk. We ask them to stay at home so they're not out spreading a potential disease throughout the community. And then we inform them what to do if they start developing symptoms. Again, this is something we do all the time, and we're continuing to do this in this situation. So that's kind of our focus and our role right now in public health. We are just expanding those efforts. Our epidemiology and emergency preparedness division are leading these efforts, and we're leading the teams that are responding to this and talking to these individuals and making sure that we're getting them the information they need. So at this point, I'm going to open it up for questions on that or any other questions that you have at this time. Okay.
Can you give us some details on how long that initial interview sometimes takes? How many contacts you guys typically follow up with?
That's a wide range. So, repeat the question. Thank you. I'm usually the one that says that. So the question was, what does contact tracing look like? How long do those interviews last? How many contacts do we have? That really varies. It depends on the amount of questions that the person has and the amount of contacts they've had, where they are ready and quarantine themselves. That speeds things up a lot. So it might be 15, 20 minutes. It can be up to an hour sometimes when we have a lot of things that we need to follow up with. And the contacts range as well. So if the person was really doing what we've been asking and staying at home and self-isolating and they haven't been around a lot of people, then that's usually a very small number of people, maybe just who's in their household. If they didn't know or they've been out in the community, then we'll follow up with those as appropriate, but it can be larger numbers depending on that, but it's usually relatively small numbers.
How many cases have you identified as community spread versus at-risk groups?
I actually don't have that information in front of me. The question was, how many cases have we identified are community spread versus the at-risk groups? I'm guessing travel associated is what you were going with that. I don't have the information in front of me. We can try to provide more detail at another point, but our team is keeping up with those details.
Do you have any information?
Just a second, Cole. There was one right
Yeah,
after.
thank you.
Could you speak to the safer at home order and how it's necessary to keep that? It could be necessary to expand that. I guess what I'm asking is, can you talk to at what point the county would have those conversations, and when is it safe to have those conversations?
So I'm asked about safer at home order and if we would have to or when we would consider expanding on that. At this point, we really are sticking with this safer at home order and asking people to do what we're requesting, that they stay at home if they are not in those essential categories. They're not those essential workers that have to get out and keep our communities going. That's our focus. I can say I've been here for 20 years and been working in communicable disease for a very long time, and the vast majority of people always do what we're asking in these situations. And so we're really relying on people to continue to follow that order. We will talk about situations with our leadership if things change, but at this point we're still focusing on the order itself.
The 20 cases that we've identified,
Mm-hmm.
6 have recovered. Do you have any information on recovery time? And the flip side of that is, of those 20, any information on how many of those might be in hospitals and more serious?
So the question was recovery time for individuals for our 20 cases, or the 6 individuals that have recovered, and then hospitalizations. I don't have the details on recovery time. It's typically 5 to 6 days when you look at the data within the community overall. And then hospitalizations, we do have 4 people that are in the hospital right now that have tested positive for COVID-19.
Any word on their condition, how serious it is to be admitted?
I can't release that at this point. It's just they're hospitalized.
Can you talk to the timing of when the safer at home was put in place and if it had to do with possible spring breakers coming back, or what the timetable was with the decision?
So I'm asked about the timing of the decision for the order. I think that's another place we can kind of step back and explain that we look at what the local and the regional situation looks like and the data that's there to support that. So decisions are made based on the amount of disease that we were seeing in the community. Our cases were going up, the region's cases were going up. And so we wanted to really do our part to try to slow the spread of disease within the community. And that's typically and will always continue to be what our decisions are based on, with our leadership team obviously in play there.
Majority of the cases that are on your website, the age range is, I think 18 to 40 is the vast majority of cases. Does that mean that social distancing is working and it's not spreading into the older population? Or does that mean social distancing is not working? and people of that age range are spreading?
So the question is that the majority of cases you're seeing on the website are people in the middle age ranges, and is social distancing working or is it not working based on the data we're seeing? And I think we still need to see more data on that. And I think that there's time that it takes for these measures to take place because there's an incubation period there. So we have to wait through that to see where we end up. I'm very hopeful that these measures that we're taking are working and will continue to work. I think that we really want to stress that this is something that our community can do to come together. We hear a lot about people are concerned and worried. There's a lot of unknowns and that scares people, and we understand that. But I think what we can do is control or take power and empower ourselves to control what we can, which is how we respond. So those staying at home when you can, and if you have to go out, to make sure that you're using these social distancing measures, you're staying away from people, you're washing your hands, you're avoiding touching your face. Those are all things that we can do to help slow the spread of the disease. And when we do those things, history tells us and pandemic planning tells us those things do work to slow the spread of disease. But I think it's really early right now to tell what's happening here.
I want to follow up on that if I could. You said it was early to tell what's happening in some ways. We understand from epidemiological models that diseases typically follow a curve of moving through the population in terms of cases. We're trying to flatten the curve. Do we know where we are on that bell curve yet? Is this still very much the upswing? When will we know that where we are on the curve, what position we are?
So the question is about knowing where we are on the curve and when will we know if we're coming down from the curve, essentially, for flattening the curve. So that epidemiological model that you hear about a lot. So I think we are very early on the front end. We do expect to get more cases. We've just started the response to this over the past couple of months, or past month or so. We're going to continue to see more cases. We won't know until we start coming down on case counts when that will be. It's just not something that we can predict. But I'm hopeful again that the measures that we've put into place does help to flatten that curve and bring it down much more to an level that we can respond and stay intact with our healthcare system in our community to do that. Mm-hmm.
Talk about the criteria for those and what, like, florists for example, are considered essential, but some people say, well, that's silly, but just talk about the different businesses and what went into those.
The questions about how the decisions were made and what are the essential business lists, where that came from. So this is a tool in our toolbox. So we've been planning in public health. We respond to outbreaks and communicable diseases, and there's been pandemic planning for a very long time. And this is one of the tools that helps to make social distancing work even better for us. That list that we utilize comes from the federal government. It's from CISA, the Cyber and Security Infrastructure Security Administration, I believe is the appropriate name for them. That list is out there, and that's the one that we utilized for determining at the federal level, so we're staying consistent with what critical infrastructure entails.
We've seen reports that the UT has offered its dorms to be used as additional hospital space. Do you have any information on that or the possible need for that?
So the question was, UT, the school has offered dorms for potential hospital space. We're in contact with UT every day. I can't really talk about what their plans are at this point. We would refer you to University of Tennessee folks for that. But we are looking, as a community, we're talking every day about how we can expand our surge capacity for our hospitals and healthcare partners. We're actually talking with our hospitals tomorrow about that, so in more detail. So I think at this point, all options are on the table for discussion, and we'll see where we end up with that.
I have just one more question.
Okay.
From some viewers about the ability to take out food from restaurants. Can you talk about the safety of that? Do people need to be worried about whether other people have touched the containers that the food is in, or safety precautions when they take out food from restaurants? Is it safe to do so?
The questions about the safety of takeout food from restaurants. Right now, the recommendation is we want to encourage people to still participate and go to businesses and support them in ways that you can. And the evidence suggests that's not the primary mode of transmission for this disease. But I always am going to go back to wash your hands. So make sure that people are washing your hands after you've gotten the food. Don't touch your face. That type of thing is very important for anything that we're doing to include that. That's how the virus gets into your body for the most part. So if you're worried about anything you've touched, make sure you're washing your hands.
There have been reports about businesses that have not been complying, that are non-essential businesses that haven't been complying with the safer at home order, and if so, what have you been doing about it?
The question is about non-essential businesses, reports that are coming in on those that are not complying with the stay-at-home order. The plan for that at this point, what we are doing is those reports are coming into 311 for the most part. Some of them are coming into us. Our environmental health and some other team members will follow up with those reports and have talks with those businesses. Again, we go back though to really trusting our community who does the right thing and continue to ask them to do the right thing for this and follow the orders as much as they can. But we are reaching out and having discussions as we're getting those reports.
Any word on how many of those reports you're getting?
I don't have that number right now. Oh, the question was any word on how many of those reports we're getting, and I don't have that information in front of me.
Last week, Dr. Buchanan talked about how the county was in early study or early discussions about creating a drive-through testing or assessment site. Could you give us an update on how that's going?
So the question is the update on the drive-through testing or assessment sites. We are continuing to explore that, working with many, many partners. issues that Dr. Buchanan has been mentioning continue to be there at this point, which are getting specimen collection supplies and PPE to support that. But we feel like we might be getting closer to that, and are looking towards how we can implement that in the near future. But we're continuing to explore that every day.
Follow-up, actually, you mentioned PPE. There's a story that's been getting a lot of play this week about the University of Tennessee 3D printing face masks, transparent plastic face masks for healthcare workers. Could you tell us how effective those are? When we think of masks, we think of something that's opaque and it's fabric and it covers the lower part of the face. These look kind of different. How do they work?
So the question is the reports of 3D printing of personal protective equipment, and they look a little bit different, and how do they work? I'm going to be honest, I have to see what those look like and what they are, and we'll have to research that a little bit more. But I think the exciting thing to point out on this is that there are efforts being made in the community to use creative technology and use our people that wouldn't normally be supporting this to be able to reach out and start doing that to help support our community response. I think that's something that's really exciting, and that we are eager to see what it comes out to. But overall, covering your face so those droplets can't get into your face is what's most important. So if they do that, I'm hopeful that they would work out, but we need to see what that looks like in more detail.
This may be a mythbuster segment if my colleagues will indulge me. From some of our viewers saying that hot water or hot tea will kill the coronavirus. Any veracity to that?
Okay, the question is hot water or hot tea will kill the coronavirus. I have not seen any evidence of that, but I will say general household disinfectants are reported across everything that we're seeing to be safe for use to kill the virus. So that's what we want to point people to, is those household disinfectants. I would not rely just on, you're talking about drinking hot water and hot tea. So we want to go to the household disinfectants for cleaning surfaces and that type of thing, and have not seen any evidence to that side. Yeah, so we really want to end, as we get towards the end of this, to talk about the community. And I'm an optimist by nature, and I always try to find the good in challenging situations. And what we were talking about earlier today that I think is important for people to hear is that seeing the level of how much we are connected to each other in these events is really opening my eyes. I hadn't thought about it as much before, and I think that knowing that we're in this together and that we're all working together and we're all doing our part. So our part is to investigate disease and try to contain that as much as we can. Individuals' homes, they're doing their part, they're using their tools by staying at home, and how we can all work together is very important. I think that all of the creative things we're seeing that people are doing to reach out to each other in these times when they can't do it in the ways they normally would are fascinating, and they're important, and we need to share those things. So when people are having chats on Google Chat and seeing each other and having get-togethers that way, we're seeing families out walking in their neighborhoods and they're checking on their neighbors. You can still knock on your neighbor's door if you have an elderly neighbor you're worried about, and step back and talk to them and check on them, get them groceries when you go to get your groceries. All of those things I think is something that's really important, and how we want to really empower our community to do what they can, to take control of what they can for this response. And I think those are things that we really want to continue to hit on and remind people on, that there's a lot that they can do to protect themselves, to protect their families, to protect their businesses, and really slow the spread of this infection so we can stay ahead of it. All right. Thank you guys so much.